Hi, darling.
Hi, Daddy.
How are you?
Good.
This is what playtime looks like for Greg Granger and his 3-year-old daughter Peyton right now.
Are you playing in your cubby house? Take me and show me.
Greg has just moved into a hotel to isolate from his family because he's working around the clock as the head of pathology operations at St Vincent's Hospital in Sydney.
Our operations escalated from, regular working hours through to a 24/7, 7-day-a-week operation.
And are you drawing pictures?
Inherently, that introduces far too much risk for myself.
All right, darling, I've got to say goodbye now. Can I have a kiss?
Hi.
A kiss?
Greg Granger is one of a growing number of healthcare workers seeking out alternative accommodation to ensure loved ones and colleagues remain safe and healthy.
It's a lot of people who will do whatever it takes to keep their family safe. A lot of young medical professionals.
Greg and his team in this pathology lab have been working long hours to process thousands of coronavirus test results.
I think all of us have considered it as a possibility to avoid infecting loved ones.
Anthony Holly works on the Covid-19 front line as an ICU doctor at a major Brisbane hospital and is president of the Intensive Care Society. Like most of his colleagues, he's still living at home, but he would consider going into isolation if the medical situation becomes substantially worse.
At what point would you make that decision? I think it would largely be based on what sort of exposure you'd had, what numbers of patients you were treating.
We now have about 300 people who've registered through us to try and find a place to stay to keep their families or housemates safe.
The five? What's the five?
Erin Riley set up the volunteer organisation Find a Bed in response to this summer's devastating bushfires.
1, 2, 3, 4.
Now she's helping to house medical staff who need to isolate.
It's been a little more challenging than it was during the bushfires. The needs are a lot more specific and people can't share properties.
Genevieve Hughes is a member of the Adopt a Healthcare Worker group who is offering rooms in her home.
I've been paired up with a GP practice nurse called Katie. Just heading upstairs to the bedrooms. Katie's been up here unpacking. Hello. Hi. How's the new digs?
Yes, I like this room.
Good. Well, that's
Yeah, I had to do this because, I'm a nurse and my partner's immunocompromised.
The absolute reason for me was that I didn't want to be responsible for his death.
Hi.
If people who aren't doctors and nurses and paramedics and people who are on the front lines, if they can do other things to help those people accept shifts they might otherwise not have accepted or get some hours sleep they might otherwise not have gotten because you've provided some sort of practical help, then, you might not have directly treated a patient, but you've helped someone who could then give more of themselves to treat patients.
Bye, Katie. Have fun at work. Stay safe. Bye.
So it's been nearly 6 weeks now since I moved into the hotel. The risk is relatively low for me now, so we remain vigilant, but we're cautiously optimistic that we're in a much better position, so it's time for me to go home.
Late last week, Greg felt safe enough to leave isolation, allowing him to reunite with Peyton.
No, it's Daddy.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 7:30's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.